Okay, so what is the future? Well, the future is that the bill was signed into law March 23rd. Many provisions went into effect on September 23rd, so have now been there for 6 months. It was repealed by the House on January the 19th. It was not repealed by the Senate, and in fact it failed 53 to 47 in the Senate. Even if it had passed the Senate and gone to the President, there's no question he would have vetoed it, and it takes a 2/3 majority of both the House and the Senate to override a presidential veto. Therefore, the effort appears to be going nowhere. Republicans are looking now at repealing individual parts of it, taking 1 or 2 parts out and creating an individual bill, unlikely to be successful. The largest target is the individual mandate, and I think the judge that ruled that if it can't have the mandate, the whole bill is unconstitutional, is where it will come down to at the Supreme Court. That'll have to be the question that gets answered at the Supreme Court. And I think right now it is a toss-up because these courts are not, as you know, free of political bias. The other thing they can do is deny funds. There's a lot of funds that are needed to set up the health exchanges. There's a lot of funds that are needed to supply the tax credits that for people who are part of the state exchanges but can't afford them. So they might go that route. Well, what's really happening now is that both the Democrats and the Republicans have decided that they're going to make this a major issue in 2012. And this will become a huge, in their mind, issue. What's really scary is that both of them are really comfortable doing that. The Democrats very much feel that everything is on their side because the polls show that even though people want the bill repealed, they like many aspects of the bill. You can expect there'll be a parade of sick people coming across the television screen that have been maimed, and so it's going to be vicious. The Republicans are convinced, based on their polls, that people don't want it, but it's going to be interesting. So when you look at it, for those that want the bill repealed, even though about 53% say they want the bill repealed, when asked, these are the same people, when asked whether states should be required to set up plans to get insurance, 78% say yes. When they ask if insurance companies should deny coverage in pre-existing conditions, 75% no, they should not. And so on down. 67% believe you should be able to insure your children, and so on down. And so the lowest it gets is 45%. Looking at that figure, if I were the Republicans, I'd be very, very nervous about taking this to the poll, because I can assure you that you will be voting on this part, not on whether the bill is repealed or not. And there'll be a huge effort to do that. And as I said, even if you repeal it, what are you going to do? Go back to 2008? Probably not. Let me finish up in about 2 minutes, 3 minutes with a survey that we have done of Texas physicians. Some of you may have taken part in this. We had 1,184 responses to our survey looking for the level of knowledge that physicians have of this act and some of their personal thoughts. And this was done in July of 2010. So it was done about 4 months after the bill was passed. Age group a little bit slanted to the late 40s and 50s. 2-to-1 males that answered it. A little bit biased towards being in practice for 15 plus years. For those that bias, less. This was an interesting slide. About a third of our responders were in solo practice, and virtually everybody was in a group of under 50 physicians. Now, there was a small group, and if you take away the universities as being in the over 50 group, there aren't very many doctors practicing here in Texas, and that is the group that is going to thrive under this system. The Mayo clinics, the Cleveland clinics are already thriving under this system. And so that we just found that interesting. It covered pretty much the full spectrum of specialties. We did ask them, and we don't know if they're honest or not, but we did ask them their leanings. And this is probably what you would expect from a group of doctors. There are more Republicans and Democrats, but a lot of independents. How do you think healthcare reform will impact the Americans' use of emergency rooms? The majority thought that either there will be no change or it will go up. Nobody thought that this was going to solve the problem of the emergency room. Primary care physicians, most thought there will not be enough primary care physicians. But when we asked them later, would they use nurse practitioners and PAs, a high percentage said no. So that doesn't fit. I mean, if there's not enough doctors, somebody's going to come into that void. This was an interesting slide. Do you think it is likely that it will be completely repealed? And about 40% thought it would be repealed in the next 12 months. Do you believe our nation's health system needs legislative reform? Virtually 85%. Even though 40% want it repealed, 85% think it needs to be reformed. So that is an extreme, again, if you're a Republican, that's a very dangerous set of circumstances on which to place your bets in the next election. Then how likely are you to change your use of physician's assistants? Only about 30% said they would increase. The rest said they would either have no change, or I'm intrigued by this group that are going to decrease it. I guess that's how they're going to save money. Fire all the nurse practitioners. But basically, no change. How likely are you to implement some of the aspects of medical homes? Basically, a third they would, 2/3 they won't. Well, you don't mean choice. I mean, medical homes are here. The government's going to use them. Get on the bandwagon and go for it. And are you more likely to make no change to your practice? That was kind of alarming. Well, 50% are sort of totally ignoring everything that we've said here, and life's going to go on as usual. Well, it's not. How important is it for Congress to pass medical liability? Well, not surprisingly, physicians think that's very important. So in summary, this law is now the law, has been for a year, 6 months, practical dealings. It could undergo some really severe challenges. In fact, it could be repealed. But the mechanism for how medicine is going to be practiced has now been set in place. And the fact that the majority of people, even the majority of physicians, like many aspects of the bill. And we had a talk the other night at the Fort Worth Club where many doctors were there, which is focused more on women, and we had the little clickers and asked them, and I think for the most part, although it was a pretty Republican-orientated group, and they all pretty much wanted it repealed, when you get down to the individual questions, more than 50% every time said they liked that part of the bill. So I just think, be thinking about it. The relationship with hospitals is going to become critical. Large groups are going to become critical. Just remember that January the 1st, 2011, all of your benchmarks are on television, but if you haven't gone to any of these 11 or 12 sites, like it's My Doctor and there's various other sites, go on there. You might be surprised that you're already there. Probably in a good way. It's a little tricky because I do know there's a Ralph Anderson obstetrician gynecologist in Connecticut. Did you know that? I went on and I saw this scathing report. And I thought, wow, who was that? Well, then I looked at it and it was Ralph Anderson in Connecticut. So I breathed a sigh of relief. But you know, they can go on and say anything they want. And now in your group, you probably should have somebody who goes to those 11 sites every morning and seeing what has been put on those sites so that at least you can counteract it. And we're looking at the whole Facebook and Twittering with our patients now and so on, and it does bring up some interesting legal challenges when you go this route, but it is the route we're going. I'll stop there. Thank you for your attention. If you have any questions, I'll be happy to stay for a little while and answer them. Okay, thanks.